if you're in the audience and you have a question, and we shall pass your question to the audience. All right. Dr. Katumba, are you ready? Thank you.
Thanks so much, Dr. Joyce. So we have one additional panelist who is joining us online. So I'll wait for the streaming team to have that going, such that the panel will be complete. Then we can get started. Right, as they get set up, I'll get started introducing what this panel is about today. First, my name is Andrew Katumba. I'm a lecturer in the Department of Electrical and Computer Engineering. I'm also the lead for the Marconi Machine Learning Lab, which is one of the main organizers of this event. I would like to thank you again, all of you, for honoring our invitation to be here at the symposium, both those who are here physically and those who are with us online. And I'll be the moderator for this session. Right. Right. As you have heard or have figured out by now that modern artificial intelligence, as we know it, is fairly new, so barely 10 years old, but it is having a tremendous impact on our lives. In the health sector especially, you've seen for yourselves, if you've known, that would be a bit sad for today, but you've seen that we can leverage AI for screening and diagnostic tools. There's a lot more going on in predicting clinical outcomes. Professor alluded to that during his talk. And then there's there is a lot going on in terms of public health with disease modeling and identifying at-risk populations and the likes. So for the health sector, without a doubt, this is one very revolutionary technology. And coupled with that, it's the fact that this is a very democratic technology, meaning that the tools and the techniques to apply to make use of this technology wherever you are in the world are available to us at our fingertips. So for today's panel, I'm very excited to present to you a team of experts, policy makers, and practitioners who are making use of AI in the health sector. And we'll be engaging on the topic, the role of AI in Uganda's healthcare systems. The first panelist we have is Professor Michael Kawoya. You should know him very well by now. Professor Kawoya is Professor Emeritus in the Department of Radiology at the College of Health Sciences, Makerere University. He's the director of Accuray, an ultrasound training institute that is affiliated with the GRA Institute in the USA. He's also the director of the Center of Excellence of the World Federation in Ultrasound in Medicine, which is also located in Kampala. I'm the chairman of the Nengo Hospital Research and Ethics Committee, also in Kampala. I have obviously not done him justice, but I think you know it would take a whole day to complete his portfolio. But Professor Kawoya is, of course, very active. He's a very active researcher in ultrasound, and he has tackled every aspect of that practice. So let's give a warm welcome to Professor Kawoya to the panel. Thank you. The next panelist is Dr. Rose Nakasi. Dr. Rose holds a PhD of Computer Science from Makerere University. She's a lecturer of computer science in Butsitema University. She's a research scientist, I guess a senior research scientist in the AI lab at Makerere University, and has done extensive work, especially around screening malaria. Rose is also the current chair of the, she's the current chair for the topic group AI-based detection of malaria at the ITU / World Health Organization in the focus group AI for Health. And her research focuses on AI and data science around improved automated tools and techniques for microscopy diagnosis for diseases such as malaria, TB, intestinal parasites in low resource settings. Welcome, Dr. Rose, to the panel. The third panelist is Dr. John Black Kabuche. Dr. John Black is a health informatics specialist at the Uganda Cancer Institute in Kampala, Uganda. He studied medicine and surgery from Makerere University and holds a Master's of Science in Health Informatics from KTH, Stockholm University in Sweden. And he has recently completed a PhD in medical informatics from the University of Amsterdam in the Netherlands. His work involves clinical care for cancer patients, clinical research, and implementation and evaluation of digital health solutions such as patient advice in IVR systems for cancer, mental health, telehealth for cervical cancer screening, and electronic health record systems. Dr. John Black is right there. He's joining us from Amsterdam right now. Welcome, Dr. John Black, to the panel.
Thank you, and pleasure to be here.
Great, thanks. Finally, last but not least, is Dr. Peter Nabende, who is a senior lecturer and head of department of the Information Systems Department in courses. Dr. Nabende has extensive experience in natural language processing for low-resource languages in Uganda, and of course in healthcare, applying machine learning to healthcare. He's the co-PI of one of the projects showcased here. That is a project on machine learning for prostate cancer imaging. You're very welcome, Dr. Nabende. Right. The first question is going out to Professor. Professor, we've seen all the different innovations or the different streams of research work that have been done here, all at a certain level that I'll let you be the judge of. But we would like to hear from you what you think are the pathways for translation of AI research to clinical settings, and what the implications are for patients and treatment outcomes. Professor?
Thank you, Mr. Chair. Translation, when you want to translate research findings into clinical practice, even as I said in my lecture, the beginning is very important. The beginning of anything is very important. And when you read the Bible, they say, in the beginning. The way you begin something actually determines the way you end. And so how do we begin? That will determine how we end. And all of us have been saying, even Professor Elikan and many of us, that the beginning should be with a problem, with a clinical problem, based on their capacity, their